Welcome to Ask the Expert, a webinar series brought to you by the Children's Tumor Foundation. CTF's mission is to drive research, expand knowledge, and advance care for the NF community. This new series is helping us pursue that mission by expanding knowledge about NF. Every month, we will invite experts to speak to a variety of topics relevant to living with NF, and those videos will be made available to you here on our website. What's even more exciting is that for 2 weeks after a video is posted, you can submit questions to that expert that will later be shared and answered on our site. This project will be hosted by me, Kate Keltz. I'm a registered nurse with nearly a decade of NF experience. I've been with the Foundation since 2014, and I am excited to bring this opportunity to our amazing NF community. Today, we will hear from Dr. Anna Maria Vranceanu, PhD. Dr. Vranceanu is a clinical health psychologist with expertise in developing, testing, and implementing skills-based resiliency interventions aimed at preventing chronic illness in patients with acute symptoms and improving quality of life and symptom management in those with incurable diseases. An internationally recognized clinician and researcher, Dr. Vranceanu serves as an associate professor of psychology at Harvard Medical School and Director of Behavioral Health Integration within the Behavioral Medicine Program at Massachusetts General Hospital. Dr. Vranceanu has been principal investigator on 10 clinical trials funded by foundations or the federal government in patients with neurofibromatosis, orthopedic injuries, and patients with acute neurological injuries and their family caregivers. Dr. Vranceanu has over 100 publications and wrote the Massachusetts General Hospital Handbook of Behavioral Medicine, which was recently published. She is also an expert in the use of technology in improving access to care for patients and families. Please welcome with me, Dr. Vranceanu.
Okay, so I'm very excited to talk to you today about resiliency skills for improved symptom management and quality of life. In our time together, we are going to talk about resiliency. We'll start with a definition of resiliency and then discuss some of the benefits of resiliency in general and specifically for patients with NF. Next, we will talk about whether we can learn to become more resilient and discuss specific resiliency skills, including a plan to incorporate resiliency skills into your daily lives. So what is resiliency? There are many definitions of resiliency out there. The one that I like the most is ability to bounce back when faced with difficulties. And these difficulties could be life stressors, big or small, as well as medical symptoms like NF symptoms. There are many benefits of resiliency, and research uncovers more and more of these benefits every day. Some of these benefits are improved mental and physical health, improved coping with medical symptoms and stress associated with a chronic illness like NF, and improved overall health and happiness. So can we learn to become more resilient? Well, older theories specified that we are born with a certain level of resiliency, and that level remains constant throughout our lives. However, now we know that we are naturally able to become resilient with age, but we can intentionally increase our resiliency by learning and practicing resiliency skills. And today we're going to talk about 3 main categories of resiliency skills that we can all learn: relaxation response skills, stress appraisal and coping skills, and positive psychology skills. And we will talk in detail about each of them. So let's start with the relaxation response skills. So this is a very complicated slide. Don't let it intimidate you. So on the left side, you see the stress response. When we perceive a situation or a medical symptom as dangerous, we immediately get thrown into the stress response. And this perception leads to changes in the body that are helping us to fight, flee, or freeze. This response is automatic and it's protective. For example, if we didn't have a stress response, we would never pay bills or go to the doctor when a new symptom developed. And our bodies are very good at dealing with being in the stress response for short amounts of time. The problem is when we stay in the stress response for too long, like when dealing with chronic symptoms or uncertainty, like it happens in NF. In these situations, there is wear and tear on the body due to being in the stress response for too long. The good news is that we also have a relaxation response, which you can see on the right, and this is the opposite of the stress response and is associated with a sense of calm and relaxation. The bad news is that the relaxation response is not automatic like the stress response. We have to do something to bring ourselves into the relaxation response. So there are many strategies that we can use to bring ourselves from the stress response to the relaxation response, and some of these have immediate effect while others have a more long-term effect. So a simple exercise is a breathing exercise. When we are in the stress response, we tense up and our breathing tends to become shallow and short. So just taking several deep and long breaths can lead to relaxation and a feeling of calm and well-being. And this strategy works really well when we are in the middle of a stressful situation. Next, guided meditations are exercises of various lengths where we follow a recording or a practitioner's guidance, and when the mind wanders, we return it back to the recording. Guided meditations are on various topics like symptom management, happiness, growth, relationships. The single-pointed meditations are exercises where we try to focus our attention on an anchor, which can be the breath, an image, a word, and then anytime the mind wanders, we bring it back gently to the anchor. And there are many apps available that you can get on your phone or on a computer to help start a meditation practice. And some of these are free, like the Insight Timer. Others ask for a fee, and some of these are Headspace or Calm. And they're really, really helpful because they keep you accountable when you first start your meditation practice. So the second set of skills are stress appraisal and coping, and they're based on the idea that our cognitions or our thoughts, our behaviors, emotions, and physical sensations are all interrelated. So when we experience stress or a medical symptom, the thoughts tend to be negative. Then the behavior tend to be avoidant, or we become very aware, hypervigilant of that particular symptom. Then the emotions become negative and the physical sensations become even more intensified. So I can give you an example from one of my current patients who have NF2. One of her symptoms is tinnitus. So when she experiences tinnitus, immediately automatic negative thoughts pop in her mind, such as, this is not fair, why do I have this? This will get worse, I can't stand it. And these thoughts, as I said, are automatic, meaning that they just pop in her mind, she doesn't choose them. These thoughts lead to avoidant behaviors, such as, I'm too sick to go to work, or I'm too sick to go to this party, and then an over-focus on the tinnitus. And then the mood associated with this is also negative. So there's anxiety, anger, and sadness. And over time, she pays more and more attention to the tinnitus, which becomes even stronger. However, what if, when the negative automatic thoughts pop into mind, they get replaced with more adaptive thoughts, such as, here it is again, it's my tinnitus. I know what it is. I'm going to be okay. I know my doctor is on top of this. I'm safe. And I'm going to go to the party, or I'm going to go to work, even though I have this symptom. So because of this, the emotions become much more positive, the mood improves, and over time, the tinnitus become less intense. So the sensation is still there, but it becomes background. It's not the center of our minds. So this exercise can really help decrease the stress or decrease the focus on medical symptoms when these medical symptoms don't have a very easy answer. The third set of, so through the stress appraisal and coping, what we try to do is we try to change negative automatic thoughts into adaptive or positive thoughts. And we do this by asking questions such as, is this thought that popped in my head, is this thought true or not? Is this thought helping me feel better? What would I tell a friend? Is there a different way I can think about this medical symptom or this situation? Is there a different explanation for what I'm feeling right now? And am I being too tough on myself? And through this process, we change negative automatic thoughts into more positive thoughts, and then the behavior and the emotions become more positive as well. The third set of skills are positive psychology skills. They're also called growth enhancement skills, such as acceptance of things that cannot be changed, positivity, like optimism and humor, empathy toward ourselves and others, and a sense of appreciation or gratitude. So we can start by talking about gratitude. So generally in times of stress, it is much easier to remember and think of the negatives than the positives. But the more we think about the negatives, the more stressed we are going to become. And even when things are going wrong, there are still some things that are going right. So by practicing gratitude and appreciation, we teach our minds to see the positive even when there is a lot of stress. And we do this by taking the time to notice 1 to 3 things that are going well, or appreciate 1 to 3 things that from your day that are positive. And they don't necessarily have to be big things. They could even be small things, like noticing the sun on your face, or noticing the smile on a child's face, or noticing when someone was nice or helpful. And so in doing this, in intentionally thinking of the things that are going right, over time, the mind learns to remember all these things, and we feel better. It is also important and helpful to remember that when we feel negative emotions, even though it feels like these negative emotions will last forever, they actually will go away. Just like positive emotions go away, the negative emotions go away as well. And so it's important to notice the emotion, name it, and let it be. So I'm feeling some anxiety, or I'm feeling some worry. It's okay. I'm just going to let it go and take my mind back to the present moment. It's also helpful to develop and use your support network. So getting involved with the NF community, with CTF, with NF forums is very helpful, and it prevents a sense of isolation that is common in NF, and it's very much a risk factor for negative emotions like depression. Developing a sense of purpose and meaning is also important. When having a rare condition like NF, it is difficult sometimes to find a sense of acceptance and meaning, but really developing a sense of meaning is key to a happy and healthy life. So it's really important to think of the silver linings of how the NF might have changed you in a positive way. And this can be very difficult to do, so be patient with yourself if you are not able to do it, but also be persistent. Many patients with NF feel that they are perhaps more empathic or more understanding of others, and generally more resilient because of NF. So if we were to put all these skills together, this is the Resiliency Program. So we have the relaxation methods, which are associated with achieving the relaxation response, so going from the stress response to the relaxation response. Then the stress appraisal and coping, which are associated with decreased stress reactivity. So we still experience stress and we still feel the medical symptoms, we experience them, but they're not as intense and they don't take over our lives as much. And then the growth enhancement skills, which are associated with increased connectedness to self and others. And so the blend of these 3 proximal components is associated with resiliency, which has genomic, structural, physiological, psychological, and functional outcomes. So really practicing these skills leads to changes in our brains, so that we become more and more resilient over time. So we've talked a lot about many skills today. So how do you get started? So my advice is to just pick one skill and try to use it consistently. And then link that skill to something you automatically do daily, like maybe brushing your teeth or having breakfast. This is important because forming new habits, particularly healthy habits, is very, very challenging. So if you want to practice appreciations, maybe you want to think of 3 things that you're grateful for every day before you go to sleep. If you want to start meditating, maybe you want to meditate for 5 minutes first thing in the morning, right before you have breakfast. And if you do this over time, these new behaviors will become habits. And then once you master a skill, you can pick another one, and so on. It's important to be flexible. Forming new habits is hard, and so you're going to miss a day here and there. You might miss a week, but that's totally okay. Just get back on track. Showing self-compassion and empathy toward yourself and then moving on every day is a new day is really important. And then be aware, it may take time to notice change in how you feel. So sometimes for some people, starting to practice the skills, they feel better immediately after. For other people, it takes a while. So it's really important to remember that your brain is becoming more and more resilient, even when you might not notice a change. So there's a process called neuroplasticity, where every time we practice a resiliency skill, even though we might not feel the benefit in the moment, our brains are getting stronger and stronger and more resilient. So I'm looking forward to getting some questions for the next 2 weeks, and thank you so much for having me.
Thank you so much for joining us today for Ask the Expert. Please remember to submit any questions you have and check back in 2 weeks for questions and answers to be posted here. Together, we will see an end to NF.